Lockdowns are easing across the world. Pubs and bars are open at last. Restaurants are taking bookings. Overgrown mains are finally being trimmed. It all feels like normality is just around the corner. But what about a second wave? Another outbreak of COVID-19 that could bring everything to a halt once again and strike during the winter months when health services are already stretched.
Amongst some of our European friends, I'm afraid you are starting to see, in some places, the signs of a second wave of the pandemic.
We may run the risk of sleepwalking into, frankly, a winter of discontent.
What's the risk of that, and how can the world stop it? To avoid a second wave, we need to understand what it is. Here's a graph of the number of COVID-19 cases in England over the last few months. As you can see, case numbers reach a peak in April and then it begins to fall and sort of plateau. So this would be called the first wave. It's a pattern that has played out in countries around the world, from Italy to South Korea to Canada. A second wave would mean a similar sustained rise in cases. And we can see from history how devastating that could be. When the Spanish flu struck early in 1918, the first wave mainly affected soldiers fighting in World War I. But a second wave began in August, which was far deadlier, killing around 195,000 people in the United States in October alone. Obviously, we can't make a direct comparison to today. The diseases are very different, and in 1918 they lacked the medical advances and pharmaceutical interventions that we take for granted today. And back then, there were barely any public health interventions, lockdowns or quarantines during the first wave. But there are lessons for us. As other US cities responded to the second wave with social distancing and lockdowns, Philadelphia, for example, held a huge parade in late September and later saw thousands of deaths. How countries deal with a second wave largely comes down to how people respond to public health measures. It's about how we behave, which is why some experts don't like the term second wave. They say that actually it's just the first outbreak re-emerging because people stop taking the disease seriously or behave in ways that make things worse.
So the second wave idea, we are in the first wave. It's going to be one big wave. It's going to go up and down a bit. Now, the best thing is to flatten it and turn it into just something lapping at your feet.
Whether or not you think this is still the first wave or a second new wave, the same point is clear.
Basic epidemiological principles would tell us if we take our foot off the pedal and go back to our old ways, then the virus is still circulating, it will increase.
As we start preparing for a possible uptick in cases, which countries can we learn from to avoid a second wave? The United States offers a good case study because it helps us avoid making similar mistakes. Many states opened up too early and dangerous hotspots of infection have been identified. In Florida and Louisiana, many cases were linked to bars reopening. They have since been closed again. That's particularly important during winter here in the UK, when people are more likely to be indoors or for extended periods of time.
And so I think we've also learned better about if we do need to go into a second lockdown, what kind of activities are high risk and which are low risk. So for example, you'd probably close first your pubs, your bars, your fitness studios, indoor closed settings with limited ventilation.
Like in Spain, where there are fears of a second wave, which forced the UK to make tourists returning from the country quarantine for 2 weeks. They quickly closed late-night bars and clubs in Catalonia to try and stem the recent spike. Australia is another country to learn from. Despite a tough lockdown and low numbers of infection during the first wave, they've had COVID-19 spikes as the country's opened up. In Melbourne, they've locked down again, and the state of Victoria has seen daily case numbers far higher than the first outbreak. Mask wearing in public is now mandatory in Melbourne and soon the whole state of Victoria.
As challenging as some may find wearing masks, we'll see the benefits of that in the days and probably the weeks to come. And that's why it may not just be a feature of the second wave, it may be a feature for many, many months to come.
A cluster of cases emerged in a pub in southwest Sydney, which was then traced back to a freight driver who had driven 800 kilometres from Melbourne and attended a party in the pub. I spoke to Professor Jodie McVernon, an epidemiologist in Melbourne, about the lessons we can learn.
That's really sharpened all of our focus on the vulnerability of long-range travel and mobility, which is still essential for logistics, supply chain and food and other things. But also, a pub is not a pub is not a pub. There are some places that are going to be particularly vulnerable to these kinds of events happening just because of where they are.
The UK recently imposed a quarantine on people returning from Spain. You found in Australia that hotel quarantine worked for those coming from abroad.
Certainly in Australia, our first wave was largely driven by imported cases. So hotel quarantine as a strategy was overall very effective in meaning that those cases didn't go on to spread in the community. And with re-importation, we've seen that spread again.
But remember, there are some countries that aren't experiencing upticks and are enjoying some normality. Look at South Korea. Here in Seoul, baseball teams can sell up to 10% of seats to fans, with those attending having their temperature taken, wearing masks, and with food and drink banned. And they still haven't seen a rise in cases anywhere near the highs seen at the beginning of March. To try and understand the risk of a second wave here in the UK, the Chief Scientific Advisor requested a report into preparing for the winter ahead, and it has some sobering warnings. The report says that if the reproductive rate, that's the R rate, of the virus reaches 1.7 by September, there could be 120,000 deaths between September 2020 and June 2021, roughly twice the number of people killed during the first wave. Now, it does say there's still a lot of uncertainty about how the virus will respond to the winter. And that death toll assumes that no public health interventions are used and that no new treatments, like a vaccine or medication, become available. But why could things be so much worse over here during the winter? It's because of two things: the nature of the virus and the difficulties faced by healthcare services in the winter months. What do I mean by the nature of the virus? If coronavirus behaves like other respiratory viruses, then it will thrive in colder climates, meaning during winter it will spread more easily.
I think that we have to assume that it'll be benefited by the winter and then be pleasantly surprised if it is not. So I think that's and that's for good and obvious reasons. People are crowded together, ventilation is much less.
A report from the Nuffield Trust found that for every 1 degree drop in temperature, the risk of death from respiratory conditions increases by about 10%. And all that comes along with the second worry, the pressure on the UK's NHS. This graph from that same Nuffield report shows the percentage of patients in A&E for more than 4 hours. There's always a rise in the winter. Older people, affected by the flu for example, are admitted and take up beds and stay longer, stretching the system. Bed occupancy has regularly peaked at over 95% in recent years during the winter. And on top of that, the NHS is already dealing with a backlog of non-coronavirus cases left over from the first wave. And the rise in influenza cases, which affects people a lot like COVID, will mean everyone showing symptoms will need to be tested and tested quickly.
So whether you could do something to test for multiple respiratory viruses at the same time, which would then allow you to say, you've got flu plus COVID, you've just got COVID, and triage much more effectively. And again, this comes back to the economic point, which is there's a very big risk with multiple respiratory viruses circulating that you end up isolating a lot of people who haven't got COVID.
That's why there's a plan now in place to ensure the seasonal flu jab is expanded. Boris Johnson called it the biggest ever flu vaccination programme in the history of the UK.
We've still got the threat of a second spike of COVID, and it's vital, therefore, to keep that pressure off the NHS by everybody getting a flu jab, and I really hope everybody will.
It's important to say that these are predictions. There are plenty of unknowns and uncertainties, but there's a real concern amongst experts that winter could see a steep rise in infections, especially if the public doesn't behave responsibly when the summer months come to an end. Experts say we have to keep doing what we've been doing: physical distancing, wearing face coverings, washing our hands, high levels of hygiene. And remember, it's going to be cold, so we'll be outside less and inside more. And a warning sign ahead of winter is what happened in parts of northern England, where new lockdown restrictions were introduced at the end of July. The Health Secretary said the increase in transmission was due to people visiting friends and relatives. And so now people from different households cannot meet in homes or private gardens.
So at the individual level, I think it's just being aware that the virus is still circulating, and that's very important. Just thinking about some of the interactions that you have and reducing some of them when they're not really necessary. I think that's the important aspect. If we can maybe halve what the sort of contacts we had prior to this pandemic, then that would go a long way in reducing transmission in the community.
And at the wider community level, crucial to avoiding a second wave is the sharing of information across the country, having a strong testing capacity available, and then for joined up action across all authorities to step in and contain an outbreak quickly. The worry is about improving contact tracing. At the time of recording, since Test and Trace began in England on the 28th of May, around 20% of people who tested positive for COVID-19 have not been reached or not provided a phone number. The UK had its first taste of local lockdown in Leicester when the city accounted for 10% of all positive cases in the country over 1 week at the end of June. The mayor said he wished the lockdown had happened earlier, and again, that comes back to communication.
I think that's something that Scotland did right from the start, is actually it gave the information and the authority to local public health boards to do the testing and the tracing and to keep on top of that so they have control of the data and the decision making. And the second is that no further economic support was provided to Leicester for that local lockdown. And so that sets a precedent that if there are local lockdowns in the future, will there be economic support provided?
The government has now given localities new powers to take control of an outbreak and impose lockdowns faster. Now, as I said at the beginning, there are still many unknowns when it comes to a second winter wave. And Boris Johnson says he hopes winter may in fact bring the return of normality.
It is my strong and sincere hope that we will be able to review the outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas.
But that goes against what members of SAGE, the government advisory body, says.
So the modelling has suggested from the beginning that the risk of a second wave is high, and there is a very significant chance that it comes back in force the way that the first wave did, and we need to be prepared for that. But of course we don't know, and we are much better prepared in terms of our understanding of the measures that need to be in place to try and deal with that.
All we know is that the UK report sets out a reasonable worst case scenario, and that predicts a huge number of deaths without intervention and prevention. It makes clear that we are not out of the woods yet, and there are things we can do as individuals and as a country to prevent a deadly second wave.